This is Dr. Steve with rockwallCPR. Back in February, there was a story of UNLV football athlete Ryan Keeler, who unfortunately died at the age of 20. The coroner's office released the cause of death, and it was cardiac dysrhythmia due to hypertrophic cardiomyopathy. So yes, he had some inherent cardiac issues. The story states that he had reported feeling sick for about the full week prior to his death. So condolences to the family. And what can we learn from this story? I'm going to click over to the American Academy of Pediatrics Pre-Participation Physical Evaluation form. This is a form that students will typically have to fill out if they play sports in high school in each state. Back in 2019, this form was updated to include any athlete. So if you have a kid who's active in sports, just physically active, they really need to have a proper physical evaluation before they pursue these activities. If it's skateboarding, if it's martial arts, if it's cycling, if it's dance, things not typically considered in the sports realm, you need to make sure that your child is okay. And if we scroll down this page, Pre-Participation Physical Evaluation Overview, there's a link for the state laws. And then here we are for the actual evaluation forms. Here is the medical history form, and then the physical evaluation form. The medical history form is something that the parent needs to fill out with their child. This is not just something you check the boxes and hand in. It's over 50 questions, and parents, you must, yes, I just said must, sit down and pay attention to these questions, because they can lead you to taking a step back and having that aha moment that says, maybe I need to get something investigated. We're not trying to build a bunch of hypochondriacs. We're trying to say, is there something in my family's medical history, in my child's medical history that says, pause, let's think about this, and let's make the right decision, and let's bring this up to the doctor. And then the physical evaluation form, well, that's what the doctor should fill out. And I'm going to be hard on this. Yes, I said the doctor. Many of these pre-participation physicals are completed by non-physicians, and this can be problematic. Not to say that an athletic trainer wouldn't do a great job, because almost all I know do. However, this is something that a physician really needs to go over, somebody who's familiar with doing these, and again, taking a step back, reading the history form. And I have to say, almost none of the providers will read the history form and put the two things together. So there's a lot you can do as an athlete. Even if you're a young athlete, you need to know this. There's a lot you can do as a parent, and there's certainly a lot you can do as a provider. And remember, we're all in this together to make it the safest experience for the athlete, so the athlete can put it all out there. I wish all the athletes the best.